Hello, in this session we'll talk about what is a drug. We'll give you the structures and some other facts about 4 drugs that will serve as examples for this course. We'll talk about their chemistry and a little bit about their chemical properties. So let's begin. First, with the definition of a drug. It originated in Middle English and was first used in the 14th century. We'll take our definitions from the online version of the Merriam-Webster dictionary, and you can go to this link yourself if you'd like. Remember, links will be on the course website, so you don't need to write them down from the videos. There are a couple of irrelevant definitions, but one very convenient definition of a drug is a substance used as a medication or in the preparation of medication. About a century ago, Congress passed the Food, Drug, and Cosmetic Act, and in that act, a drug was defined as a substance recognized in an official pharmacopoeia or formulary, and you can go to the FDA's website, fda.gov, to see the FDA's pharmacopoeias. There are several of them. One for humans, one for animals. You can also define a drug as a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of a disease. A very general use is a substance other than food intended to affect the structure or function of the body. Then there are some irrelevant definitions. And we come to another use of the term drug, something, and often an illegal substance that causes addiction, habituation, or a marked change in consciousness. And so that would be really an abused drug. So let's talk about trivial names and structural formulas for the 4 drugs we're going to consider in this session and in the next session. First, of course, will be nicotine. We'll also discuss procaine, we'll discuss morphine, and we'll discuss botulinum toxin. So these are our 4 example drugs for this session. And you'll see they are markedly different. Botulinum toxin seems to have a very different cartoon than the other drugs. We'll get into that. But these 4 drugs exemplify the concepts in drugs in the brain. Drugs activate and block ion channels. A drug that activates ion channels is nicotine, and one that blocks ion channels is procaine. Drugs act on G protein pathways. That would be morphine. Drugs activate genes eventually. That would be nicotine and morphine. Protein drugs may become more useful for neuroscience diseases. That would be botulinum toxin. I should add that botulinum toxin does not get into the brain. It actually works in the peripheral nervous system at the nerve muscle synapse. That's an important distinction. There are very few protein drugs that do work in the brain these days. A handful, and they are much less used than botulinum toxin. So we'll remain with botulinum toxin for today's example. And there are also drugs that act on neurotransmitter transporters. We'll talk about them later in the course, but we won't give an example in today's session. So here are the atomic scale structures of each of the 4 drugs. Now, we are going to be recommending and getting used to several of the databases sponsored by the United States National Institute of Health. So let's begin by going to the database for nicotine. We're going to a database called PubChem. We'll click on this URL, and you'll be able to do that from the Coursera website as well. Here we are. We're going to PubChem, and we go to the page for nicotine. We can see its structure as well as several of its properties: molecular weight, molecular formula, log P, and we'll talk about the log P later on. And we can see either a simple structural formula, or we can also go to a 3D conformer. And so What are the color codes here? Well, the universal color code for nitrogen is blue. There are 2 nitrogen atoms in the nicotine molecule. The color code for carbon is often gray or nondescript. We can see, let's go back to the simple form. Here are the 2 nitrogen atoms. We have a conjugated, an aromatic ring, so that's the double bonds here. And you learned about aromatic rings in chemistry. You know the fact that they are delocalized, hybridized. Now let's go to the 3D conformer again, and we can even go to another program just by clicking on this one. It generates a 3D view, and we'll see the actual molecule in 3 dimensions rotating around a bit. You can do this on your own Windows machine or on your own Mac machine. You can do it on an iPad as well. All of these links will work in those 3 systems, and I haven't checked whether they work in Android, but presumably they will. So let's go now to the same kind of structure for procaine. We'll click on procaine. You can see it here. We can do its 3D conformer. These are obviously very important databases, and they are funded by the NIH from public funding. That is, in the case of those of you who pay taxes to the US, by your tax dollars. We could do the same for morphine. When we talk about a protein drug, we go to a different database. We go to a database that's related to the protein structure database. So let's click on that and go to it. This database is also at the NIH, actually at the National Center for Biotechnology Information. And it is a database that's linked to the files for structure of every protein whose atomic scale structure has been solved either by X-ray crystallography or by NMR. I think those are the 2 major topics these days. And we can view these structures using one of several viewers. We're set up here to use a viewer called CN3D, which means literally see in 3D. Let's try to do that. We'll click on it, and we'll open it. And we get a window, and we'll enlarge that window, and we see the structure for botulinum toxin. Let's click on a particular style, and I have placed on the Coursera web page a style that we call Coursera, and we can move around the protein in its structure. Now, this particular database uses a file called the PDB, protein database file, and the NIH converts this file into one that's useful for CN3D. We can see 2 major classes of structure. This is one protein. We can see that there are rods and that there are ribbons. As we'll learn later on in the course, these are alpha helices and beta sheets. We can rotate it around, and I'll show you in a later session how we can identify these structures and how we can actually view them in stereo. And we'll go on to the next topic in atomic scale structures. And this will be to point out to you that in a drug molecule, each moiety, each part has importance. Here, for instance, we're looking at procaine. Procaine has lots of carbons. We usually don't show the hydrogens, but when they're important to show to make a principle, for instance, when we are showing hydrogen bonds, then we show them. Here is a nitrogen, here are a couple of oxygens, and here is the aromatic group. Here's another nitrogen. To give you an example that each moiety in a drug molecule has importance, I'll point out that the charged amine, this picks up a proton and becomes charged. Here is the charged amine. can bind to charged groups on the protein, oppositely charged groups, or to pi electrons on the protein. We'll discuss the cation-pi interaction a bit later. This is an ester. We can see the ester moiety, the carbonyl oxygen, the ether oxygen. This ester can be hydrolyzed by enzymes in the body to rapidly terminate drug action. This is important for a local anesthetic like Procaine because we want it to stop acting pretty soon. I should point out that Procaine is also one of those drugs that works primarily in the peripheral nervous system rather than in the brain. And finally, we have an aromatic group that may bind to nonpolar groups on the receptor protein. So a chemist or a medicinal chemist is interested in all of these groups and how to design new drugs that do their jobs better. Here are the overall elemental formulas for the drugs that we're considering today. Procaine has this formula. Its molecular mass is 162. Nicotine. Procaine is a bit heavier. Morphine is a bit heavier yet. And botulinum toxin as a protein is much heavier. And of course, each of the drugs we're using now are sold by manufacturers and have trademark names. Nicotine, of course, is a component of cigarettes, and so it has various trademarks as cigarette brands. It's also sold as a gum and also as a patch. Procaine has been around for more than a century, but it is also used, it has several trademarks depending on which manufacturer sells it. Morphine, likewise, has been used for centuries, and it has several trademarks. Botulinum toxin, when used in the senses we're going to use it today, also has a trademark, Botox. In terms of the type of compound, both nicotine and morphine are called alkaloids. They're a group of nitrogen-containing organic compounds that have physiological effects on humans. That is, they're drugs, and they're usually natural compounds. Procaine, on the other hand, is a synthetic drug. It's a local anesthetic. And botulinum toxin is a protein, and as we'll learn in a later session, a protein is a chain of amino acid residues joined by peptide bonds. So that was our introduction to what is a drug, and during our next session we'll talk about additional aspects of how drugs enter the brain.